44-year-old male patient came for MRI for evaluation of cervical spondylosis. MRI was performed. Sagittal T2 weighted MRI images showing a hyperintense signal in the posterior cord extending from C2 to C7 levels. Fat sat images for evaluating T2 fat sat images for evaluating the hyperintensity. Here you can appreciate the posterior cord hyperintensity, which is slightly extending anteriorly. However, the tectum and posterior pons middle are normal. Axial images. Here you can see classical inverted V sign. You can appreciate here. This is typical involvement of dorsal columns. So again, inverted V sign is appreciated here in this level. So these are the hyperintensities within the dorsal columns. So retrospectively, we have evaluated. Patient also had numbness of both upper limbs from 10 to 12 days, and there was urinary incontinence from 15 days. He was a strict vegetarian from childhood. So the final diagnosis we made with the above imaging findings and classical history is subacute combined degeneration. Subacute combined degeneration is usually presents with loss of vibration and proprioception in the hands and feet, which eventually progresses to sensory loss of all modalities, sensory gait ataxia and distal muscle weakness, especially of the legs. Features of dementia may also become apparent in later stages. It is mainly because of deficiency of vitamin B12. In the developed world, where nutrition is generally adequate, it tends to result because of pernicious anemia, but other causes like Crohn's disease, terminal ileitis, gastrointestinal surgery are also causes. Celiac disease, atrophic gastritis, and abuse of nitrous oxide for recreational abuse are also other causes. And three, additionally, it is also can be seen in strict vegetarians and undernourished people. They also can develop deficiencies and subacute combined degeneration. So classically, the MR features are, you can see, you can get symmetric bilateral high signal within the dorsal columns, which we could appreciate in our case, the inverted V sign. And it will typically involve the upper thoracic region, and it can have ascending and descending progression. Sometimes, rarely, you can see lateral corticospinal tracts also. The lateral spinothalamic tract can be involved in case of subacute combined degeneration. Contrast enhancement will not be seen in these cases. Sometimes they can be associated cerebral white matter changes in cases of subacute combined degeneration. So management is oral supplementation, and the injections also can be given. Approximately 50% of the patients can completely recover following the treatment. So in our case, there was a hypersegmented nuclei and neutrophils, and there was classical decreased vitamin B12. Thank you very much. Hope this case was useful for you.